people, it is a brand new day to start the day on October 21st, 2022. Broadcasting from Future Studio Jakarta, I will serve you the latest news nowadays for minutes. And this is your morning update. The first news comes from China. Panda twins are born in China as the species struggles for survival. Twin giant pandas have been born at the breeding center in southern western China, a sign of progress for the country's unofficial national mascot as it struggles for survival amid climate change and loss of habitat. The male and female calves born Tuesday at the Xinling Panda Research Center in the Shanxi province are the second pair of twins born to their mother, an artificially bred panda, Xinxin. Another panda, Yongyong, gave birth to twins at the center earlier this month. Xinxin was also born at the center and previously gave birth to twin females in 2020. Shanxi started raising the Xinling giant panda artificially in the 1980s with a major artificial breeding technology system. A total of 36 panda cubs have been bred in the province. Chinese veterinarians for years have been using artificial insemination to boost the population of the animals, which rarely reproduce in the wild and rely on a bamboo diet in the western Chinese mountains. With some captive bred pandas are being released into the wild, the population of wild pandas has picked up gradually, reaching an estimated 1,800 heads. About 500 others live in a captivity in zoos and reserves, the majority in the mountainous, heavily forested province of Sichuan. Moving to United States, U.S. hospitals brace for an unprecedented winter of viruses. Hospitals nationwide are preparing for another winter with COVID, the first one that is also expected to include high levels of influenza and other respiratory illness that have simmered quietly in the background for the past 2 years. Flu cases are already rising in a part of the U.S. According to the Center for Disease Control and Prevention, pediatricians are seeing a growing number of children sick with a respiratory syncytial virus or RSV and enteroviruses, and despite a downward trend in the COVID, tens of thousands of new cases are still being diagnosed every day. The convergence of viruses is hitting healthcare systems as they are forced to reckon with staffing shortages that worsened during the pandemic. Healthcare workers are quitting at least 23% higher than when the pandemic began, mirroring a larger nationwide trend of workers leaving their jobs, according to health system tracker by Peterson on Healthcare and Kaiser Family Foundation to monitor how well the U.S. healthcare system is performing. Dr. Bernard Cummins, medical director for infection prevention at the Mount Sinai Health System in New York City, has noted a similar mass exodus of healthcare workers who retired early and or moved to a different line of work altogether. Despite the shortages, hospital leaders applaud healthcare workers who have been able to stay the course and are ready for this next phase of infectious disease. That's all for the news today. You can also visit our website at www.futurenews.com to get more information. Have a nice day and stay tuned.